platforms, data flow, and claims. As has been shown, the Kenya's 108,000 plus community health promoters brings service closer to households. The electronic community health information system now connects the community encounters to facilities and the Kenya Health Information System, thereby accelerating decisions and closing referral loops, as has been referred to. These are real equity gains for Kenya, especially in the hard-to-reach settings. On the financial end, the SHA has stabilized digital claims processing, a very essential step to turn service delivery into timely payments. Just a few words again also on the devolution advantage and counties, especially counties as engines of inclusive digitization. The devolution brings proximity needed to design for language, literacy, connectivity gaps, disability inclusion, and gender dynamics. This also, the human rights and social justice framing of today's program is therefore for us the correct lens. It measures digital health by who benefits first, not just who is already connected. For WHO, we provide 5 design tests for equity, justice, and inclusion. For us and for the global health community, before any solution scales, WHO proposes that counties and vendors must pass this test. 5 of them. 1, access. The system must work offline, degrade, and also be able to degrade gracefully on low-end devices, 2G or 3G. 2, usability. The contents in Kiswahili and relevant local languages, low literacy designs are essential for usability. 3, safety, clear clinical scope, human oversight. 4, protection as well as accountability, which logs, metrics, and user feedback loops made accessible to counties and communities. From the discussion so far, these are already being put in place, so this is really great for the government of Kenya and the leadership. Looking forward, we want to propose some practical steps that the country needs to fully examine, learning from best practices from around the world. In this regard, we want to propose county compact for digital health. And I will just give some 3 near-term commitments. To translate the principles outlined already into practice within the next 12 months, let us agree at this conference to have 1 inclusive service charter per county for digital health, which includes the language disability features, grievance channels, uptime targets. Second, 1 certified stack for priority use cases. For example, antenatal care immunization NCDs per county, also procured against the DHA certification framework. 3, 1 protection drill per county. We ensure that, especially at this point where we have issues of hacking, we also propose as part of this compact 1 protection drill per county annually, some form of tabletop exercise, because as you will agree with me, if there is a breach in the data, it will have significant impact on the rollout of this initiative. So going forward, WHO's role and offer to Kenya will include strengthening the governance and safety, advance data stewardship and trust, scale up equity, primary healthcare digitalization, and we also provide you global platforms to align your resources and work with you on benchmark progress openly. In conclusion, let me reaffirm WHO's unwavering commitment to working alongside Kenya on this remarkable digital health journey. Together, we are not just digitizing healthcare, we are democratizing access to quality health services for every Kenyan. The future we envision is one where a mother in Turkana can access the same quality of digital health services as one in Nairobi, where a community health promoter in Homa Bay has the same digital tools as specialists in Kenyatta National Hospital, where equity, justice, inclusion are not just aspirations, but actually everyday reality for Kenya's digital health ecosystem. WHO stands ready to continue this partnership, supporting Kenya's vision of a digitally inclusive health system that leaves no one behind. Together, we will ensure Kenya's digital health transformation becomes a global model for health technology that can actually serve humanity's highest aspiration, as well as that of all Kenyans. Asante sana. Asanteni sana. Thank you.
Thank you so much. Because of time, I will invite Chairman of DHA just to say one word. DG, please come closer, and then DG to take over the program and conclude. Chairman, DHA, please.
Our Cabinet Secretary, Honorable Haden Duale, our DG Health, Dr. Amoth, WHO Country Representative, Chair Health COG, digital health stakeholders, national and county government officials present, conference delegates, ladies and gentlemen, good afternoon. Welcome to Digital Health Side event. The DHA has been in existence now for 1 year. And as chair of DHA, I'm happy to report that we have navigated through both operationalizing and as we began, we are implementing in earnest the Digital Act 2023. And like we always say, we have done what we thought, much more than we could do. And we are born and we are already running. The agency recognizes its monumental role as a crucial enabler in the delivery of universal health coverage through use of technology to transform how health is delivered. In the past, the DHA, through intentional collaboration with partners, has been able to deliver digital solutions that are boldly contributing strategically towards improving how healthcare is delivered in this country. Esteemed conference delegates, investments in digital health hold great promise for transforming healthcare systems and improving health outcomes. It is our aspiration that digital health transformation will result in improved clinical experience, increased health provider satisfaction, increased accountability and efficiency, resulting in overall improved quality of healthcare. That is preventive, promotive, and curative. At the agency, we are inspired by the Japanese Kaizen philosophy towards continuous improvement. Today, we get an opportunity to reflect, that is, smile at what went right, learn from what we did not do as planned, and visualize what the future holds as regards optimal digital health transformation. Ladies and gentlemen, in conclusion, the agency is launching its first strategic plan today. This plan reflects a shared national ambition to build a resilient, future-ready, and people-centered health system. On behalf of the agency, we sincerely appreciate all who have been part of the DHA's journey. The commitment and support from Ministry of Health leadership, led by our indomitable CS, Aden Duale, has also been truly inspirational. Thank you so very much, Wasiri. Asanteni for joining us today. I now welcome our DG Health. Take over.
Thank you, Chair. Honorable CS, allow me to ride on prior established protocols because of time. The transformative journey towards digitization of health services in Kenya has begun, and great progress is already demonstrated. Coverage has already reached more than 50% of the countries, and we are on track to be able to achieve 100% coverage before the end of the year. And we are already celebrating the dividends of this investment, as clearly highlighted by the CEO of Digital Health Agency. We have reduced turnaround time for our pre-authorization processes. We have upped our fraud detection mechanism, and through track and trace, we have enhanced our capacity for pharmacovigilance and accountability in our processes. Data is the new currency, and now we are collecting real-time data. And this data is also hosted in-country, and therefore it is easy for us in terms of decision-making. This work is not only taking place at the facilities, but it's also happening at the community level. We have the electronic community health information system that also collects data at the household level. We are soon joining the League of Nations, who collect data on a day-to-day basis, real-time, rather than wait for periodic surveys conducted every 5 years, like the Kenya Demographic Health Survey. Therefore, this is the right thing to do, and for sure, it is going to have a transformative change in our health ecosystem. Allow me to invite His Excellency the Governor of Tharaka Nithi County, who is also the chair of the Health Committee at the Council of Governors, to make some remarks and thereafter invite our chief guest for the event. Your Excellency.
Thank you very much, Dr. Omoth, our substantive DG, Honorable Aden Duale, the CS for Health, and for the sake of time, all protocols observed, I recognize you all and I salute you. We are running against time because there's another event taking place here, and for that reason, CS allow me to make very brief remarks. First and foremost, I want to thank the DHA team led by Engineer Anthony. From where we sit as the Council of Governors, their partnership has not been without hitches, but it is one of the best agencies we work with, because from where I sit, DHA has gotten us from a habit that we had in Kenya, where we used to have a book called Kitabu ya Hospitali. It used to be half a book, and our patients used to carry them along with them everywhere they go. And the biggest killer of patients in Kenya was not the wrong diagnosis. It wasn't lack of medicine. It was inconsistency of health records that made doctors treat patients who are referred with the same treatment they had in the last previous treatments or visits without realizing that that was not working because there was no record. The birth of DHA from the three laws that were passed, courtesy of Kenya Kwanza, has come to resolve this problem, and our patients are very happy nowadays, walking to hospital, carrying nothing, and they find the records there, even the records of the hospitals they visited before from their previous visits, which are not necessarily the same hospitals. That is a game changer. We are looking forward to a time when a patient in Kajiado will have the need to be seen in Bagathi, and they just walk in, give their ID card, and their records will be there, with their data being correct and also protected, because that is very, very important, not just to us as a country, but also for the patients. So data protection is something that we need a guarantee on, Anthony, because that has been our biggest worry as Council of Governors. I'd also like to, at this particular time, hail you for giving us a promise to give us end-to-end visibility, which includes a dashboard for the CEC in charge of health, also the governor. And I am briefed that that system works on and off, but I'm sure with the effort you put to reach out more counties, this is an issue that will be resolved. Lastly, counties had existing systems or digital health systems. Some of them were inferior to what DHA is offering. Some of them have resistance in accepting DHA because they feel they have had an investment. But if you're giving me a Ferrari and you're telling me to crash my VW, which is very old, I would have to make my calculations whether the VW serves any purpose. We are therefore urging the county government, if you have a system that's inferior to a DHA system, it does not matter how much you invested in it. If the DHA system will serve you better, you had better take that one. With those very few remarks, it's now my humble duty to call the CS Health, and even as you comes, and let's give him a clap. Counties have committed to give free treatment in level 2 and 3 and 4, but CS urge patients also to make sure they register for SHA, because you cannot get treatment if we don't know who you are. They must register. Thank you very much.
The Chair of Health Committee of the Council of Governors, Excellency Governors and Deputy Governors, Senators, Honorable Members of Parliament, County Assembly, senior national and government officials, our partners, distinguished guests. Ladies and gentlemen, it is my distinct honor to attend this year's devolution conference in the beautiful county of Homa Bay, as we reflect on the theme for people, for posterity, devolution as a catalyst for equity, inclusion, and justice, social justice. I am particularly delighted to contribute to this dialogue from the perspective of health care digitization. Universal health care remains one of the most important, powerful tools for advancing equity, justice, and inclusion. Yet many Kenyans, especially in the remote and underserved areas, still face barriers to timely, quality, and affordable health care. Digitization offers a unique opportunity to bridge these gaps. It is more than technology. It's a transformational tool for efficiency, for accuracy, for equitable access, for transparency, and for citizen engagement and empowerment. The Ministry of Health has made digitization a core pillar of the ongoing health sector reforms through very key initiatives, including the Taifa Care digital platform, which integrates healthcare records, telemedicine, insurance management, facility data, and to make sure that we provide care, we prevent fraud, and we improve patient safety and experience. We are also doing community health digitization through the Smart CHAP app. Community health promoters can now register households, report illness, track maternal and child health, and make referrals, hence boosting our surveillance, our responsiveness, and our accountability to the people of Kenya. On supply chain and resource tracking, we now provide real-time monitoring of medicines, vaccines, and medical equipment, reducing stockouts, wastage, and disparity. And finally, on health financing and inclusion, using our digital IDs and mobile money to enroll vulnerable population into the social health insurance, hence enhancing financial protection and reducing unnecessary cost. Ladies and gentlemen, devolution has been a game changer in aligning health priorities with the local realities. Counties are best placed to implement innovations that meet the specific needs of their population. The Ministry of Health continues to work closely with the county governments in the rollout of digital health infrastructure at all levels. We are working with you to build capacity of health workers and ICT officers. We are working with you to strengthen data governance, privacy and cybersecurity, and we want to make sure, colleagues and partners, that equity is not an outcome, it is a deliberate choice. Inclusion and justice in healthcare must be embedded in our system design. We want to ensure that our platforms are accessible to persons with disability. Our platforms are available in local languages. Our platforms are gender responsive. And our platforms are affordable to all. No Kenyan should be left behind in the digital health revolution, regardless of their location, their income, and their identity. Kenya digital health transformation is here and is real. It's reshaping how we deliver care, improve efficiency, and safeguard public resources. Through the Social Health Authority, the ministry is using technology as an engine for equity, accountability, and trust. Since October, SHA has disbursed 57.7 billion to health facilities, and of this, 49.7 billion was channeled to the Social Health Insurance Fund and emergency, chronic, and critical illness, while 6.7 billion supported the primary health care fund. And let me make it very clear here. Our primary health care fund is the one that makes Kenyans to access outpatient in level 2, level 3, and level 4 free of charge, paid by the government of Kenya, appropriated and budgeted by Parliament. When fully integrated, biometric verification will work with real-time claims processing, enabling instant eligibility checks, faster reimbursement, and accurate data, patient data across all our counties. Beyond fraud prevention, this system builds citizen trust and provide actionable insights on service use, on the trend of diseases and spending in order to allow us to make smart investment and fast response. Ladies and gentlemen, Kenya experience demonstrates that digital health innovation, when anchored in sound policy and sustained by strong political will, as shown by the President and the government, and those of us who work with him, and our county governments, we can deliver a patient-centered, fraud-resistant, data-driven health system serving a model for Africa health resilient agenda. And in this spirit, today is a significant milestone with the launch of the Digital Health Agency Strategic Plan, alongside other guiding documents. This will serve the compass for advancing our nation's health digitization agenda. In conclusion, we reflect on the next frontier of devolution. Let us reaffirm our collective commitment to equity, justice, and inclusion through technology-enabled health system. The Ministry of Health stands ready to walk this journey together with all our partners, all our counties, and our communities. We will close the gap and we will open the future. With those many remarks, it's now my duty and honor to launch the Digital Health Agency Strategic Plan. Yeah. Please, let's clap for DHA. You will not expect hard copies. This is digital. Colleagues are asking me where the copy, so I told them this is digital. So you get your copy digitally, online. Thank you very much.
May we appreciate the CS for Health, Honorable Aden Duale, and his team once more. A better round of applause, ladies and gentlemen. Thank you.